Hello class, welcome to Chapter 14, Bleeding, Shock, and Soft Tissue Injuries. After students complete this chapter and the related coursework, they will understand the significance and characteristics of bleeding, the importance of standard precautions when treating a bleeding patient, the types and causes of shock, the signs and symptoms of shock, the types of soft tissue injuries and how to treat them, the use of bandages and dressings, and the assessment and care of different types of burns. Introduction. EMRs need to be able to recognize and care for patients who are suffering from shock, bleeding, and soft tissue injuries. Good adherence to the standard precautions is important when caring for patients with soft tissue injuries. Damage to internal soft tissues and organs can cause life-threatening conditions. Internal bleeding causes the patient to lose blood in the circulatory system and results in shock. Shock is a state of collapse of cardiovascular system that results in inadequate delivery of blood to the organs. More trauma patients die from shock than any other condition. EMRs should also learn to gauge the extent and depth of burns and understand their causes. This figure shows the patient assessment sequence for trauma patients. You may perform the secondary assessment before obtaining a sample history. Patient assessment for bleeding, shock, and soft tissue injuries. It is important to follow the steps of the patient assessment sequence when caring for patients who are bleeding, are in shock, or have soft tissue injuries. The scene size-up needs to include all the steps you learned previously to ensure safety for you and the patient. When performing the primary assessment, you may need to temporarily halt the assessment if the patient is losing a significant amount of blood. During the secondary assessment, be alert for any signs and symptoms of shock from internal or external blood loss. When obtaining a sample history, ask the patient whether he or she is using a blood thinner, which may interfere with blood clotting. For trauma patients, you will usually perform the secondary assessment before you obtain the sample history. When performing a reassessment, watch the patient for signs and symptoms of shock: pale skin, increasing pulse rate, and decreasing blood pressure. Standard precautions and soft tissue injuries. The concept of standard precautions assumes that all body fluids are potentially infectious. Take appropriate measures to prevent contact with the patient's body fluids. Wear gloves to prevent contact with the patient's blood. At times, you may need to wear a surgical mask and eye protection if there is danger of blood splatter or if the patient is coughing or vomiting bloody material. This figure shows the circulatory system includes the heart, arteries, veins, and capillaries. At the center of the system is the heart, which pumps the blood. Parts and function of the circulatory system. The pump. The heart functions as the human circulatory system's pump. The heart consists of 4 separate chambers. The 2 upper chambers on the top of the heart are the left and right atrium. The atria are somewhat less muscular than the ventricles. They serve as reservoirs for blood flowing into the heart from the body and the lungs. The 2 lower chambers on the bottom of the heart are the left and right ventricles. The ventricles are the larger chambers and do most of the actual pumping. This figure shows how the heart functions as a pump of the human circulatory system. The pipes. The human body has 3 main types of blood vessels. The arteries carry blood away from the heart. The capillaries, the smallest of the blood vessels, form a network that distributes blood to all the parts of the body. The veins return the blood from the capillaries to the heart, where it is pumped to the lungs. The fluid. Fluid in the circulatory system consists of blood cells and other blood components. The liquid part of blood is plasma. Plasma serves as the transporting medium for the solid parts of the blood. Red blood cells carry oxygen and carbon dioxide. White blood cells have a search and destroy function. They consume bacteria and viruses to combat infections in the body. Platelets interact with one another and with other substances in the blood to form clots to help stop bleeding. Pulse. A pulse is the pressure wave generated by the pumping action of the heart. When you are counting the number of pulsations per minute, you also count the number of heartbeats per minute. Usually, you can feel a patient's radial and carotid pulses. In a conscious patient, you can easily find the radial or wrist pulse at the base of the thumb. If the patient appears to be in shock or is unconscious, attempt to locate the carotid pulse first. Place 2 fingers lightly on the larynx and slide the fingers off to one side until you feel a slight notch in the neck. You should be able to feel the carotid pulse at this location. You should be able to locate the pulse within 3 seconds of touching the person's larynx. Shock. Shock is defined as the failure of the cardiovascular system. Cardiovascular failure has many possible causes, but the 3 primary causes are pump failure, pipe failure, or fluid loss. Pump failure. Cardiogenic shock occurs when the heart can no longer pump enough blood to supply the needs of the body. Pump failure can result if the heart has been weakened by a heart attack. Inadequate pumping of the heart can cause blood to back up in the vessels of the lungs, resulting in congestive heart failure, CHF. Pipe failure. Pipe failure is caused by the expansion or dilation of the capillaries to as much as 3 or 4 times their normal size. This causes blood to pool in the capillaries instead of circulating throughout the system. When blood pools in the capillaries, the rest of the body is deprived of blood. Blood pressure falls and shock results. Blood pressure is the pressure of the circulating blood against the walls of the arteries. In shock caused by sudden expansion of capillaries, blood pressure may drop so rapidly in the patient that you are unable to feel either a radial or a carotid pulse. 3 types of shock are caused by pipe failure. Shock induced by fainting, or psychogenic shock. Fainting is the body's response to a major psychological or emotional stress. As the nervous system reacts, the capillaries suddenly expand to 3 or 4 times their normal size. Fainting is a short-term condition that corrects itself once the patient is placed in a horizontal position. Anaphylactic shock, caused by an extreme allergic reaction to a foreign substance. Shock may develop very quickly following exposure. The patient may suddenly start to sneeze or itch, develop a rash of hives, and experience swelling of the face and tongue. The patient appears flushed, breathing may quickly become difficult, and blood pressure drops rapidly. The pulse may also be so weak that you cannot feel it. Death will result if prompt action to counteract the toxin is not taken. Spinal shock may occur in patients who have sustained a spinal cord injury. The injury allows the capillaries to expand and the blood to pool below the level of the injury. The brain, heart, and lungs and other vital organs are deprived of blood, resulting in shock. Fluid loss. Fluid loss is caused by excessive bleeding or hemorrhaging. Is the most common cause of shock. Blood escapes from the normal closed circulatory system through an internal or external wound, and the system's total fluid level drops until the pump cannot operate effectively. The heart begins to pump faster to maintain pressure in the pipes. As the fluid continues to drain out, the pump will eventually stop pumping altogether, resulting in cardiac arrest. External bleeding is easy to detect because you can see blood escaping from the circulatory system. With internal bleeding, the bleeding cannot be seen, but you may see signs of internal blood loss. Bruising, swelling, rigidity in the affected area, and severe pain in the immediate area. Whether the bleeding is external or internal, if it remains unchecked, the result will be shock, eventual pump failure, and death. An average adult has 12 pints, or 5.7 liters of blood circulating in the system. The loss of 2 or more pints of blood can produce shock. Signs and symptoms of shock. Shock deprives the body of significant blood to function normally. As shock progresses, the body alters some of its functions in an attempt to maintain sufficient blood supply to its vital parts. A patient who is in shock may exhibit some or all of these signs and symptoms: confusion, agitation, restlessness or anxiety, cold, clammy, sweaty, pale skin, rapid breathing, rapid weak pulse, increased capillary refill time, nausea and vomiting, weakness or fainting, and thirst. Changes in the mental status may be the first signs of shock, so monitoring the overall mental status of a patient can help you detect shock. The capillary refill test and the condition of the skin will help you recognize shock in a patient who have dark skin. General treatment for shock. To combat shock for any causes and keep it from getting worse, take these steps. Position the patient correctly. If the patient has no head injury, extreme discomfort, or difficulty breathing, lay the patient flat on his or her back on a horizontal surface. Place a blanket under the patient. Elevate the patient's legs according to local protocol. If the patient has a head injury, spine injury, or lower extremity injury, do not elevate the legs. If the patient is having chest pain or difficulty breathing and no spinal injury is suspected, place the patient in a sitting or semi-reclining position. Maintain the patient's ABCs. Check the patient's ABCs at least every 5 minutes. If necessary, open the airway, perform rescue breathing, or begin CPR. Treat the causes of shock if possible. Most patients are in shock must be treated in the hospital. You will be able to treat one common cause of shock, external bleeding. Control external bleeding with direct pressure, elevation, tourniquet, or pressure points. Maintain the patient's body temperature. A patient with cold, clammy skin should be covered. Place blankets under the patient to keep body heat from escaping into the ground. Do not allow the patient to eat or drink. Patients in shock may be nauseated, and eating or drinking may cause vomiting. Patients in shock may need emergency surgery and should not have anything in their stomachs. If you are working in an area where ambulance response time is more than 20 minutes, you may give the patient a clean cloth or gauze pad that has been soaked in water to suck on. Assist with other treatments. When an advanced life support ALS unit arrives on the scene, be ready to assist those personnel with further treatment. If you are trained in the administration of oxygen and have it available, provide it to shock patients. Advanced EMTs or paramedics can administer intravenous IV fluids. Some emergency medical services EMS personnel use pneumaric anti-shock garments, or PASGs, in the field to treat pelvic fractures. However, PASGs are no longer favored for shock treatment. Arrange for transport. As soon as you determine that the patient is in shock, you should make sure that an ambulance has been dispatched. When the ambulance arrives, give the EMS personnel a concise handoff report. The EMS personnel will make sure that the patient is quickly prepared for prompt transport to an appropriate medical facility. Treatment for shock caused by pump failure. Pump failure is a serious condition. Your proper treatment and prompt transport by ambulance to an appropriate medical facility will give these patients their best chance for survival. Treatment for shock caused by pump failure. Treatment for anaphylactic shock. The patient must be transported as soon as possible. Paramedics, nurses, and physicians can administer medications that may reverse the allergic reaction. Some patients who have severe allergies may carry an epinephrine auto-injector. Support the patient's thigh and place the tip of the auto-injector lightly against the outer thigh. Using a quick motion, push the auto-injector firmly against the thigh and hold it in place for several seconds. Treatment for shock caused by fluid loss. Shock caused by internal blood loss. It is important to recognize the early signs and symptoms of internal bleeding. If you are treating several injured patients, those with internal bleeding should be transported first because immediate surgery may be needed. Bleeding from stomach ulcers, ruptured blood vessels, or tumors can cause internal bleeding and shock. This bleeding can be spontaneous, massive, and rapid. In addition to the classic signs of shock, patients with internal bleeding may show other signs and symptoms: coughing or vomiting of blood, abdominal tenderness, rigidity, bruising, or distension, rectal bleeding, and vaginal bleeding in women. The figure below shows the 3 types of external bleeding. The top left is capillary, the top right is venous, and the bottom is arterial. Bleeding. Controlling external bleeding loss. The most common type of external blood loss is capillary bleeding. The blood oozes out. It can be controlled simply by applying direct pressure to the site. The second most common type of bleeding is venous bleeding. This type of bleeding has a steady flow. Apply direct pressure to the site for at least 5 minutes. The most serious type of bleeding is arterial bleeding. Arterial blood spurts or surges with each heartbeat. Unchecked arterial bleeding can result in death from loss of blood in a short time. Exert direct pressure and maintain pressure on the site until EMS arrive. It is vitally important that you control external bleeding quickly. Direct pressure. Place a dry, sterile dressing directly on the wound and press with a gloved hand. Wrap the dressing and wound snugly with roller gauze bandage to maintain direct pressure. Do not remove a dressing after you have applied it, even if it becomes soaked with blood. Place another dressing on top of the first and keep both dressings in place. Elevation. If direct pressure does not stop external bleeding from an extremity, elevate the injured arm or leg as you maintain direct pressure. Tourniquets. The use of tourniquets is indicated only in situations where extremity bleeding cannot be controlled by direct pressure or elevation. High-velocity gunshot wounds or explosive devices can sever arteries in the arms or leg. To reduce death from these types of wounds, the military has developed and adopted several modern versions of tourniquets. A tourniquet can be applied and left in place for up to 2 hours without causing significant damage to the affected limb. Use tourniquets only if you have completed proper instruction in their use and have protocols in place that have been approved by your medical director. Follow the steps in Skill Drill 14-1 to control bleeding with a tourniquet. Pressure points. If direct pressure and elevation do not control the bleeding, and you are not permitted to use a tourniquet, use pressure points. Pressure points can be used in cases where a wound is too close to the trunk to apply a tourniquet. Pressure points prevent blood from flowing into the limb by compressing a major artery against the bone. The brachial artery pressure point in the upper arm and the femoral artery pressure point in the groin are the most important. When you're applying pressure to the brachial artery, remember the phrase slap, slide, and squeeze. Position the patient's arm so the elbow is bent at a right angle and hold the upper arm away from the patient's body. Gently slap the inside of the biceps with the fingers halfway between the shoulder and the elbow to push the biceps out of the way. Slide your fingers up to push the bicep away and squeeze your hand down on the humerus. You should be able to feel the pulse as you press down. If the patient is sitting down, squeeze the arm by placing your fingers halfway between the shoulder and the elbow and your thumb on the opposite side of the patient's arm. The femoral artery pressure point is more difficult to locate and squeeze. The figure below shows the brachial artery on the left and the femoral artery on the right. Standard precautions in bleeding control. Some communicable diseases can be spread by contact with blood from an infected person. Minimize this risk by wearing nitrile or latex gloves whenever you might come in contact with a patient's blood or bloody fluids. If you do get blood on your hands, wash it off as soon as possible with soap and water. If you are in the field and cannot wash your hands, use waterless hand cleaning solution that contains an effective germ-killing agent. Wounds. A wound is an injury caused by any physical means that leads to damage of a body part. Wounds are classified as open or closed. Closed wounds. The skin remains intact. The only closed wound is the bruise contusion. A bruise is an injury of the soft tissue beneath the skin. Small blood vessels are broken. The area becomes discolored and swells. A simple bruise heals quickly. Bruising and swelling may be signs of an underlying fracture. Open wounds. An open wound results in a break in the skin. Abrasion, also called a scrape, road rash, or rug burn, occurs when the skin is rubbed across a rough surface. The figure below shows abrasions involve variable depths of the skin. They are often called scrapes or road rash. Puncture occurs when a sharp object punctures the skin, may cause significant deep injury that is not immediately recognized. Puncture wounds do not bleed freely. If the object that caused the puncture wound remains sticking out of the skin, it is called an impaled object. A gunshot wound is a special type of puncture wound. The amount of damage depends on the type of gun used and the distance between the gun and the victim. A gunshot entry wound may appear as an insignificant hole, but can do massive damage to internal organs. Gunshot wounds usually have an entrance wound and an exit wound. Puncture wounds may penetrate the skin to any depth. Laceration. Most common type of open wound, commonly called a cut. Minor lacerations may require little care. Large lacerations can cause extensive bleeding and even be life-threatening. Lacerations are cuts produced by sharp objects. Avulsions and amputations. An avulsion is a tearing away of body tissue. The avulsed part may be totally severed from the body, or it may be attached by a flap of skin. If an entire body part is torn away, the wound is called a traumatic amputation. Amputated parts should be located, placed in clean plastic bag, kept cool, and taken with the patient to the hospital for possible reattachment. Cold ice packs or ice water can be used to keep the detached body parts cold. Do not allow the ice to touch the body part directly. Avulsions, raised flaps of tissue. Significant bleeding is common. Principles of wound treatment. Very minor bruises need no treatment. Other closed wounds should be treated by applying ice and gentle compression and by elevating the injured part. Because extensive bruising may indicate an underlying fracture, you should splint all major contusions. It is important to stop bleeding as quickly as possible using the cleanest dry dressing available. You can usually control bleeding by covering an open wound with a dry, clean, or sterile dressing and applying pressure to the dressing with your hand. If the first dressing does not control the bleeding, reinforce it with a second layer. Additional ways of controlling bleeding include elevating an extremity, applying a tourniquet, or using pressure points. A dressing should cover the entire wound to prevent further contamination. All dressing should be secured in place by a compression bandage. As an EMR, you should be able to bandage all parts of the body quickly and competently. Dressing and bandaging wounds. Dressing and bandaging wounds are applied to achieve the following goals: control bleeding, prevent further contamination, immobilize the injured area, and prevent movement of impaled objects. Dressings. A dressing is an object placed directly on a wound to control bleeding and prevent further contamination. Once a dressing is in place, apply firm, direct manual pressure on it to stop any bleeding. Sterile dressings come packaged in many different sizes, but the three most common sizes are 4x4 gauze squares, heavier pads that measure 5x9, and trauma dressings, thick sterile dressings that measure 10x30. Touch only one corner of the dressing when opening a sterile package. If bleeding continues after you have applied a compression dressing to the wound, put additional gauze pads over the original dressing. Once the wound is sufficiently dressed, bandage the wound. Bandaging. A bandage is used to hold the dressing in place. Two types of bandages are commonly used in the field: roller gauze and triangular bandages. Confirming, roller gauze stretches slightly and is easy to wrap around the body part. Triangle bandages are usually 36 inches across and can be folded. Principles of bandaging. Ensure that the dressing completely covers the wound and extends beyond all sides of the wound. Wrap the bandage just tightly enough to control the bleeding, but not so tightly that circulation is cut off. Check circulation regularly because swelling may make the bandage too tight. Secure the bandaging so that it cannot slip. Several precaution techniques for the EMR. Wear gloves to avoid contact with patient's blood. Nitrile or latex medical gloves can be stored on top of your EMR life support kit or in a pouch on your belt, where they will be readily available. Specific wound treatment. Face and scalp wounds. Due to the large blood supply in these parts of the body, a relatively small laceration to the face and scalp can result in large amounts of bleeding. You can control almost all facial or scalp bleeding by applying direct manual pressure. Direct pressure compasses the blood vessels against the skull and stops the bleeding. The figure below shows bandaging a head wound. Left picture shows applying direct pressure until the bleeding stops, and the right shows wrapping the head with a bandage. For wounds inside the cheek, hold the gauze pad inside the mouth. Always keep the airway open. Severe scalp lacerations may be associated with skull fractures or even brain injury. If any brain tissue or bone fragments are visible, do not apply pressure to the wound. Cover the wound loosely, being careful not to exert direct pressure on the brain or the bone fragments. With head injuries, the neck and spine may also be injured. Move the head as little as possible and stabilize the neck. Carefully monitor the patient's airway and breathing and protect the spine. Nosebleeds. Nosebleeds can result from injury, high blood pressure, or dry air. A nosebleed with no apparent cause is called a spontaneous nosebleed. A patient with high blood pressure should be seen and treated by a physician. Most nosebleeds can be controlled easily. Unless the patient is experiencing shock, have the patient sit down and tilt the head slightly forward. Pinch both nostrils together for at least 5 minutes. If the nosebleed persists or is very severe, arrange for transport to an appropriate medical facility. Eye injuries. All eye injuries are potentially serious and require medical evaluation. When an eye laceration is suspected, cover the entire eye with dry gauze pad. Have the patient lie on his or her back and arrange for transport. If a small foreign object is lying on the surface of the patient's eye, you can use a saline solution to gently flush the object from the eye. flush from the nose side towards the outside to avoid flushing the object into the other eye. Occasionally, an object will be impaled in the eye. Immediately place the patient on his or her back and cover the injured eye with a dressing and a paper cup so the impaled object can't move. Bandage both eyes and arrange for transport. Neck wounds. The neck contains many important structures, so all neck injuries are considered serious. Use direct pressure to control bleeding. Once bleeding is controlled, dress the neck. In rare cases, you may have to exert finger pressure above and below the injury site to prevent further neck bleeding. Major trauma to the neck may be associated with airway problems and with neck fracture or spinal cord injury. Maintain the patient's airway and stabilize the head and the neck. Chest and back wounds. The major organs affected by chest wounds and back wounds are the lungs, large blood vessels, and heart. Any wound involving these organs is life-threatening injury. Place the patient with a chest injury in a comfortable position. If a lung is punctured, air can escape and the lung will collapse. The patient may cough up bright red blood. Help maintain air pressure in the lung by covering an open chest wound with an airtight material. Such a covering is called an occlusive dressing. Use a clear plastic cover, aluminum foil, plastic wrap, gloves, or a special dressing that has been impregnated with petroleum jelly. Administer oxygen if available and you are trained to use it. Chest wounds may damage the heart. Seal the wound and monitor the patient's ABCs. Treat the patient for shock and perform CPR if necessary. If the patient's breathing becomes more labored after you seal the chest wound, remove the seal briefly to allow excess air to escape. Reseal the wound. Impaled objects. Apply a sterilizing dressing. Arrange for the patient's immediate prompt transport. Sometimes an impaled object is too long to permit the patient to be removed from the accident scene and transported. It may be necessary to stabilize the impaled object. Carefully cut it close to the patient's body. If the patient has a knife or other object protruding from the abdomen, do not attempt to remove the impaled object. Support the object so it cannot move. Place large roll of gauze or towels on either side of the object and secure the rolls with additional gauze wrapped around the patient's body. Closed abdominal wounds commonly occur as a result of a direct blow from a blunt object. Look for bruising or other marks on the abdomen that indicate a blunt injury. Whenever an injured patient is experiencing shock, there may be internal abdominal injuries accompanied by bleeding. The abdomen may become swollen, rigid, or hard like a board. Treat these patients by placing them on their backs and elevating their legs if indicated by local protocol. Use blankets to help conserve their body heat. If a patient is vomiting blood, it may be an indication of internal bleeding from the esophagus or stomach. Monitor the patient's airway and vital signs because shock may occur. Give the patient nothing by mouth. Arrange for prompt transport. Open abdominal wounds. Usually the result of slashing with a knife or other sharp object. If the intestines are protruding from the abdomen, place the patient on his or her back with their knees bent to relax the abdominal muscles. Cover the injured area with sterile dressings. Do not attempt to replace the intestines inside the abdomen. You can make a bandage from a large trauma pad and several cravats to cover the protruding intestines. EMTs and paramedics carry sterile saline that can be poured on the dressing to keep the protruding organs moist so they do not dry out. The figure below shows bandaging an open abdominal wound. Top left, place the patient on his or her back and knees bent to relax the abdominal muscles. Top right, cover the injury area with a sterile dressing. Do not attempt to replace the intestines inside the abdomen. Bottom left, place a large trauma pad over the wound. Bottom right, use several wide carvettes to loosely cover the trauma pad. Place them just tight enough to hold the abdominal contents in place. Genital wounds. Both men and female genitals have a rich blood supply, so injury to these areas may result in severe bleeding. Apply direct pressure with a dry, sterile dressing. Although it may be embarrassing to examine the patient's genital area to determine the severity of the injury, you must do so if you suspect such injuries. Extremity wound. Apply a dry, sterile compression dressing and bandage it securely in place. Elevate the injured part to decrease bleeding and swelling. Splint all injured extremities prior to transport because there may be an underlying fracture. The figure below shows bandaging an extremity wound. Left, place a dressing over the wound. Center, secure the dressing with a cravat, and secure the dressing with a roller bandage. Gunshot wounds. Most deaths from gunshot wounds result from internal blood loss caused by damage to internal organs and major blood vessels. Prompt and effective treatment is important. Gunshot wounds to the trunk and neck are major cause of spinal cord injuries. Because you cannot see a bullet's path through the body, you should treat these patients for spinal cord injuries. To treat a patient with a gunshot wound, follow these steps. Open the airway and establish adequate ventilation and circulation. Control any external bleeding by covering wounds with sterile dressings and applying pressure with your hand or a bandage. Examine the patient thoroughly to locate all entrance and exit wounds. Treat the patient for symptoms of shock. Maintain the patient's body temperature. Place the patient on his or her back and elevate the legs if indicated by local protocol. Place the patient who is having difficulty breathing in a semi-reclining position. Administer oxygen if available. Arrange for prompt transport. Perform CPR if the patient's heart stops as a result of loss of blood. Bites. Bites from animals or humans may range from minor to severe. All bites carry a high risk of infection. Bites from an unvaccinated or wild animal may cause rabies. Minor bites can be washed with soap and water. Major bite wounds should be treated by controlling the bleeding, applying a suitable dressing and bandage. Patients should seek out treatment for all animal and human bites. In most states, you are required to report animal bites to your local health department and law enforcement agency. Burns. The skin serves as a barrier that prevents foreign substances from entering the body. It also prevents fluid loss. When the skin is damaged, it can no longer perform these essential functions. Burn depth. Superficial burns, or first-degree burns, are characterized by reddened, painful skin. The injury is confined to the outermost layer of the skin. The patient experiences minor to moderate pain. Partial thickness burns, or second-degree burns, are somewhat deeper but do not damage the deepest layers of the skin. Blistering is present. There may be some fluid loss and moderate to severe pain because nerve endings are damaged. Usually heal within 2 to 3 weeks. Full thickness burns, third-degree burns, damage all layers of the skin. Pain is often absent because the nerve endings have been destroyed. Patients with full thickness burns lose large quantities of body fluids and are susceptible to shock and infection. If the patient has injuries in addition to the burn, treat those injuries before transporting the patient. Extensive burns. The rule of nines is a method for determining what percentage of the body has been burned. In an adult, the head and arms each equal 9%, and the total 9% of the total body surface. The front, back of the trunk, and each leg are equal to 18% of the total body surface. The rule of nines is significantly modified for young children. The figure below uses the rule of nines to determine the extent of burns. Cause or type of burns. Thermal burns. Thermal burns are caused by heat. Place the burn area in cool, cold water to help reduce pain. After the burn area is cooled, cover it with dry, sterile dressings or a burn sheet. If blisters are present, be careful not to break them. Cut any clothing away from the burned area, but leave any clothing that is stuck to the burn. Patients with large burns must be treated for shock and transported to the hospital. Respiratory burns consists of burns to any part of the airway. If a patient has been burned around the head and face while in a confined space, look for signs and symptoms of respiratory burns. Burns around the face, singed nose hair, soot in the mouth and nose, difficulty breathing, pain while breathing, loss of consciousness as a result of the fire. Breathing problems can develop either rapidly or slowly or over several hours. Administer oxygen as soon as it's available and be prepared to perform CPR. Arrange for prompt transport. Chemical burns. Many strong substances can cause chemical burns to the skin. The chemicals are extremely dangerous to the eyes. These substances include strong acids, such as battery acid, and strong alkalines, such as drain cleaners. The longer the chemical remains in contact with the skin, the more it damages the skin and underlying tissues. The initial treatment for chemical burns. Remove as much of the chemical as possible from the patient's skin. Brush away any dry chemical on the patient's clothes or skin. Flush the contaminated skin with an abundant quantities of water for at least 10 minutes. Cover the burn area with a dry, sterile dressing or a burn sheet. Arrange for prompt transport. Chemical burns to the eyes cause extreme pain and severe injury. Gently flush the affected eye or eyes with water for at least 20 minutes. You must hold the eye open and allow the water to flow over its entire surface. Loosely cover the injured eye or eyes with gauze bandages. Arrange for prompt transport. Electrical burns. Electrical burns can cause severe injuries or even death. They leave little evidence of injury on the outside of the body. These burns occur when electrical current enters the body at one point, travels through the body tissues and organs, and exits the body at another point of ground contact. Electricity causes major internal damage rather than external damage. Patients may experience irregularities of cardiac rhythm or full cardiac arrest and death. Persons who have been hit or nearly hit by lightning frequently sustain electrical burns. Treat the patient as you would electrical burn patients. Evaluate them carefully and arrange for prompt transport. Be certain that the patient is not still in contact with the electrical power source before you touch or treat him or her. Unplug, disconnect, or turn off power first. Call for assistance from the power company or from the qualified rescue squad or fire department. If a power line falls on top of a motor vehicle, the people inside the vehicle must be told to stay there until qualified personnel can remove the power line or turn the power off. Monitor the airway, breathing, and circulation of electrical burn patients and arrange for prompt transport. Multisystem trauma. Multisystem trauma is an injury that affects more than one system of the body. As an EMR, you are not expected to diagnose a patient's injuries. Several body systems may be injured in situations that involve significant trauma. As you assess patients, be alert for signs and symptoms of injury to each part of the body. Summary. This chapter covers the knowledge and skills you need to treat patients who are experiencing shock, bleeding, and soft tissue injuries. You must take appropriate standard precautions to prevent contact with the patient's body fluids. The three parts of the circulatory system are the pump, heart, the pipes, arteries, veins, and capillaries, and the fluid, blood cells, and other blood components. Shock is a state of collapse of the cardiovascular system that results in inadequate delivery of blood to the organs. Three primary causes of shock is pump failure, pipe failure, and fluid loss. The general treatment for shock is positioning the patient correctly, maintaining the patient's ABCs, and treating the cause of shock if possible. There are three types of external blood loss are possible: capillary, blood oozes out; venous, blood at a steady flow; and arterial, blood spurts or surges. Most external bleeding can be controlled by applying direct pressure to the wound. A wound is an injury caused by any physical means that leads to damage of a body part. Wounds are classified as closed, skin remains intact, or open, skin is disrupted. Open wounds are classified as abrasions, punctures, lacerations, avulsions, or amputations. Control bleeding by covering an open wound with a dry, clean, or sterile dressing and apply pressure to the dressing with your hand. Additional ways to control bleeding include evaluating an extremity, applying a tourniquet, or using pressure points. Three classes of burns are distinguished based on the burn depth: superficial, first-degree burns; partial thickness, second-degree burns; or full thickness, third-degree burns. Burns may be caused by heat, chemicals, or electricity. By learning to recognize and provide initial emergency treatment for patients experiencing shock, bleeding, and soft tissue injuries, you will be able to provide physical and emotional assistance to these patients in their time of need. At times, your prompt recognition and treatment will make a real difference in the outcome. Injuries that affect more than one body system are called multi-system trauma. Multi-system trauma may be a result of an injury to one part of the body, or it can be caused by injuries to different parts of the body. Okay, class, let's go over some review questions. Review question 1. Which of the following statements regarding the standard precautions is true? A. Standard precautions assume that all body fluids are potentially infectious. B. Standard precautions assume that some body fluids are potentially infectious. C. Standard precaution apply to paramedics who perform invasive procedures. D. EMRs are only required to wear gloves to comply with standard precautions. The correct answer is A. Standard precautions assume that all body fluids are potentially infectious. Review question 3. Appropriate management of impaled objects in the eye include A. Bandaging only the affected eye. B. Rinsing the eye with saline. B. Bandaging both eyes. And D. Removing an object to prevent further damage. The answer is C. Bandaging both eyes. Review question 3. Patients with full thickness burns generally do not complain of pain because A. Blister formation protects the burn. B. The nerve endings have been destroyed. C. Deep burns produce a natural painkiller in the patient's system. D. The patient is generally not conscious. The correct answer is B. The nerve endings have been destroyed. Okay, class, this concludes the lecture on Chapter 14, Bleeding, Shock, and Soft Tissue Injuries. If you have any questions or concerns, please contact your instructor, and I will see you in the next chapter.